do you remove suspected melanoma on scalp? How do you decide what margin to take? It's a bit of a technical question. Yep, we would remove a melanoma on the scalp. So the thing about a melanoma is that it's often difficult to be sure it's a melanoma before you take it off, and sometimes you might not even think it's a melanoma before you take it off. It's just a mole, maybe a changing mole, maybe a worrying mole, but until you've got histology on it, then you don't know if it's a melanoma or not. So the right way to treat a melanoma, so the answer is yes, we would remove a melanoma on the scalp. The right way to treat a melanoma is to take off the lesion, take off the mole, send it away for histology, and get a result there to tell us whether it's a melanoma or not. Because obviously if it's not a melanoma, that's that. If it is a melanoma, then we would go and take a wider margin. But the problem is the margin that we take is dependent on the depth of the melanoma in terms when they look at it under a microscope, how deep it's invaded. So that's a microscopic measurement. You can't see that by looking. You can't tell how deep a melanoma is by looking at it. You have to send it away for histology. And so you might need a 1 or 2 centimeter margin around the scar. So with a melanoma, you need another operation afterwards, which is a wide local excision of the scar. And sometimes there'll be things to do in terms of the lymph nodes, sentinel node biopsies, things like that. But in terms of the margin, we wouldn't take a margin of the original lesion. So there'd be no point in taking a 1 centimeter or 2. You just don't take a margin simply because 1, you don't know what it is, and 2, you don't know how deep it is. So you would take it off with a kind of just a few, like 5 millimeter margin, and then you would wait for the histology to come back. The problem with the scalp is the skin on the scalp is quite tight. And so it can be a problem if you can't close it. So what we normally do is cut the melanoma out and stitch it up, and then come back another day and do a wide local excision of the scar. And usually the wide local excision, because usually it's 1 or 2 centimeters, requires some kind of reconstruction to fill the defect, which would be a skin graft, classically maybe a flap. But the problem with them, if it's a kind of big mole on the scalp and we would struggle to close it, then we've got an issue as to what we do, because you don't want to do a skin graft for the first op where you just take the thing out, because you know that there's a good chance you might need to do another op, and so you don't want to sort of cut out your skin graft for the second op. So then you might just put a dressing on it for a while and hopefully get a quick result, ideally, because you ideally want to get the whole of the lesion out and send for histology. You don't really want to do a little biopsy of it. You don't really want to take a little piece of it away. That's not really a good thing to do for melanoma. For melanoma, you want to take the whole lesion out, so that it is troublesome when you've got a quite a big lesion in a difficult area like the scalp or like the hand, palm of the hand, sole of the foot, things like that. But yeah, the general principle is you take the lesion away, the mole away completely, you get it sent for histology, and then when you know A, whether it's melanoma or not, and B, how deep the melanoma is, that's when you would go and do a wider margin, which will be 1 or 2 centimeters, depending on the depth of the melanoma. And that usually requires some kind of reconstruction, usually a skin graft, and we have to go quite deep with that wide excision down to fascia. So the skin graft often kind of sits in quite a dent. You take quite a large piece away when you do a wide local excision after a melanoma.